Hi, my name is Ashley. I'm a nurse practitioner student, and today we are going to be performing a peripheral vascular exam. I am going to take in general appearance and vital signs and do my hand hygiene, and we'll start with inspection of the arms. Looking at the arms, skin color is appropriate for ethnicity here. There's no swelling noted in the arms. I am looking at the nail beds here, and nail beds appear to be pink, which is a normal finding. And then taking in the overall appearance of the venous system of the arms, there are some prominent veins noted in the hands. Moving to the legs on inspection, legs, I don't know any swelling. Again, the skin color is appropriate for ethnicity. Looking at the nail beds, they appear to be pink. Hair distribution is appropriate bilaterally. And then overall, just looking at the skin, I don't know any areas of hyperpigmentation, ulcers, rashes, or scars on the lower extremities. I am going to ask the patient to stand, and I'm going to assess for any varicosities present when the patient stands. And there are some veins noted just in the lower extremities, but otherwise no abnormal findings. Thank you. Next, we're going to begin with palpation of the arms. Going to assess the radial pulses. And then I'm going to assess for brachial. And then I'm going to assess, so for radial and brachial pulses, the amplitude was +2, which is a normal finding. And then we're going to assess for any epitrochlear nodes. We expect to find no nodes, but we'll still palpate. I'm going to slightly flex the patient's arm and support it and just palpate for any nodes. And if I were to find nodes, I would describe the size of the nodes, mobility of the nodes. And then same thing. No nodes present in either arm. Next, we're going to assess for capillary refill. So to assess for capillary refill, I'm just gently pressing on each of the nail beds. And what I'm expecting to find is that within 2 to 3 seconds, a pink color will return to each of the nail beds, which is what I noted on this exam. Next, we'll move on to palpation of the lower extremity. So we'll begin with palpating the pulses. We'll do the femoral, we'll do the posterior tibial, the popliteal, the dorsalis pedis, and then the posterior tibial. So to assess for the femoral pulse, I'm going to place my fingers right at the anterior superior iliac spine and the symphysis pubis. So it's best to do this with the patient lying down, but we'll assess this bilaterally again. Okay. And then for the the popliteal, again, I have the patient slightly flex the knee. And then I'm placing both my hands behind and assessing. This one can be difficult to feel, but again, we'll assess it bilaterally. Since we're down here, we'll do the dorsalis pedis. So we're going just slightly lateral to the great toe. And then finally, we'll do the posterior tibial. Okay. So pulses were felt in each location. I would grade these as a +2. Popliteal pulse is a little bit difficult to assess, but I was able to identify the popliteal pulse. Next, we will palpate the inguinal node. So we'll look horizontally and vertically for these nodes and just palpate. In this region, node between 1 to 2 centimeters is appropriate. That would be an appropriate finding. Did you have any pain or tenderness with that? Okay, patient reports no pain or tenderness with palpation. We're going to assess, inspect for temperature. So with the backs of my hands, I'm just going to feel Her temperature skin is warm underneath. And while I'm here, I'm just going to assess for any edema as well. Looking in the feet, I don't know any edema, but if I did, I would indent my thumb into the skin and note the indentation that my thumbprint left behind. And then we're going to finally palpate for these nail beds here. Once again, same thing with the hands. I am palpating each toe and just making sure that color returns, which it does. There is a special test that we could do with the radial artery and the ulnar artery. So I am going to ask the patient to make a fist. We'll just use this right hand, so we'll make a fist, and then I will occlude the radial and the ulnar side. I'm going to release the ulnar side and ask the patient to open the hand, and a pink color returns within 2 seconds of the patient letting go. And then I'll have you do it once again. And this time I'm going to release the radial side, and then, pink color noted as well. So radial and ulnar arteries are patent. There is another test that we could do to assess for arterial insufficiency, and that would involve the patient beginning at a 60-degree level. We would wait to note pallor in the lower extremities, and that takes about a minute. And then we would ask the patient to sit up, and then we would have them dangle their lower extremities and note how long it takes for color to return. And that can be anywhere between 10 to 15 seconds. And again, we would do that if there were any abnormalities present on this exam. And this concludes our peripheral vascular exam. Thank you.